lovely people, I'm Nurse Jacko and I'm here with my sister,
midwife Abraka Patience.
We are entreating you all to follow Nurse Kelvin TV and subscribe to his YouTube channel. And your data will never go waste.
And you'll be blessed.
Bye bye.
Hi guys, my name is Amaji Kelvin and you're welcome back to Nurse Kelvin TV. As we have been giving you guys back-to-back content, today too we are here with one of our beautiful sisters, and I can say that you guys have been seeing the flyers all around. A lot of you want to know the story. What's the title now? That particular flyer, I say tennis story. And I know say a lot of you want to know about this story, whether it's a broken heart story or what story. But this one is different, and this one I know say is going to motivate you, going to give you a lot of encouragement. Guys, before we start the video, in case you want to fix your phone, you want iPhone, wine, keypads, BBR phone, BBR, go to iFix Technology and go for you good papa. One a phone, my BBR mamia. The video here brown open papa correct so abuja na wako Kofi Kunadu Avenue abuja on so to correct cakes pa boy shemini na Kofi Kunadu and the share abuja to us. So today we are here with this beautiful lady. A lot of you know, I know say be more hunoda be more action and yama breda. Today we are here to give you whatever you need to hear or whatever you need to know about Tina. Whatever you need to know about Tina. You didn't hear Ernestina Ajako, but my friend Tina. My friend Tina. Yeah, she's a very beautiful girl. Sister Tina, you are welcome to Nurse Kelvin TV.
Thank you so much.
But you know how are you?
That's your day.
Yeah, to also. Sister Tina, we've been seeing your flyers around. Say you want to share your story about sickle cell.
Exactly.
And all those nyama. But before that, we want to know who Sister Tina is.
Okay. So, as Nurse Kelvin already said, I go by the name Ernestina Ejako Amwako, and I'm the last born of my parents. My dad is Mr. Ejako, my mom is Sister Ejako, and I'm an ordinary girl living my life. I've graduated from the nursing training and I'm doing my national service, of which coming May we'll be done with the service. So I wanted you guys to know my story so that it will give much encouragement to the people out there.
Okay, guys, it is said I'm not saying another bro for the day, yeah. So, Sister Tina, we want to ask that how was your journey with the sickle cell? How has it been?
All right, thank you for the question. My journey with the sickle cell has not been easy. Okay. And I know my fellow people out there living with the disease will testify that it's not easy to be born a sickler. It's never easy. But if you have determination in your eyes and you are ready to push forward in life, everything will be okay for you. Okay,
so when we talk of sickle cell, what is sickle cell?
Okay, sickle cell is a genetic disease that causes the red blood cell to get a concave shape. Under normal circumstance, the red blood cell has to be round and has to be flexible and can move through the body, carry oxygenated blood each and everywhere that is supposed to be needed. But with this sickle cell disease, the red blood cell is not supposed to form the same shape as it's supposed to form, and it causes pains in the joints and swelling, making you feel much pains in the bones. And it's genetics. It's carried from parents to offspring.
Okay, so one must say, how did people normally get this sickle cell disease, or what causes this disease?
The cause of this disease cannot actually be explained because it's genetics, it's in the genes. So as you grow and you want to find a partner, you have to check the genotype, and the test for it is electrophoresis or sickle cell test. So far as you have a trait in you, you don't have to marry someone with the same trait. Yeah. So if you both are carriers, you definitely give birth to a sickler, and you will you suffer, and the children will also suffer. So that is it. So we have to give awareness to people, the young ones that are coming, to be specific in choosing their partners. Don't follow love to let your children suffer. You have to just be okay. Know that this person that I'm going to marry is maybe not career or not a career, so that you make a good plans for your future to prevent future generation from suffering.
So what are some of the challenges that you face or you have faced living with sickle cell?
Thanks for the question. The challenges have not been easy.
Okay.
Through school, junior high school, SHS, nursing training, it hasn't been easy. Okay. Sometimes you feel you are odd. You are odd among some people, most especially when you're going to school and it's raining. You see some people maybe wearing raincoats, umbrellas, they are okay, they are going. But so far as you pass through the rain and some small drizzle on you, you start to feel pain.
Nana be what if you name sabro for now.
Okay, so in so tall, yeah, in so tall and so big go to Kakrabi and I so be sure no, and then send be ya will be back. What person?
Meaning say I won't buy you guys.
Exactly.
You have problem.
We suffer a lot.
Yeah. So aside those challenges, what other challenges do you know facing?
Oh, the challenges are many. Sometimes people don't understand your pain. Sometimes they feel you are faking your pain. But pain, like sometimes I wish some people feel some of the pains. Yeah, that's we feel. Sometimes you be in pain. You tell your friend or you tell someone close to you that maybe I'm having crisis. And please, when you talk of crisis, the sickle cell pains, that is called the crisis. When you feel crisis, sometimes you'll be crying, you say, oh, I'm feeling pains here, but they think you are faking the pain and you are overdoing it, like you're exaggerating the pain. But it doesn't go that way. And so far as your body carry bones, everywhere that bone is located, no, the crisis can be there, making the blood too thick or viscous. So the flow of oxygenated blood cannot go through it's called swelling at the joints, and most especially when it comes to your chest, we have something called acute chest syndrome. Chest syndrome. It's very painful. So it hasn't been easy in this government. It hasn't been easy. But
so one must say, how were you able to endure or manage all this pain, go through all these symptoms and all those stuff?
As I say, it hasn't been easy. And to be born a sickler or with a sickle cell, when you go to the hospital and they ask you, maybe you're feeling pains in your joint or maybe your chest or anywhere the crisis has happened, you go and they'll ask you, what is your problem? They say, oh, I'm a sickle cell victim and maybe type SC or type A. That would be a story for another day. So when you go, they know that you are in severe pains. So what they will do is to hydrate you. So far as the blood is thick or viscous, the hydration will help the blood to be a loose, lighter, so that the flow of blood can be able to circulate through all the body and everything. And they'll give you pain medications to just reduce the pain so that you can rest more.
Okay. So have you faced any stigma or other challenges?
Exactly. Yeah. I've faced many stigmas. Yeah.
That people are saying a lot of stuff, and can you share some with us?
Okay, like as I said earlier on, people will not understand your pain and they think they are like you're exaggerating your pain. And sometimes people will be like, maybe you'll be friends with someone, you vibe with the person and everything, but if you offend them small, then they will start somewhere like, you're sickler like you, maybe you're not my type of sickler. But I didn't let all those stigmas break me. So far as I'm a human, and I know I'm a human, but I'm differently abled, but not disabled. I'm abled in many parts, so I'm differently able, and I can do everything that normal or ordinary people do. So sickle cell disease shouldn't deter you from going forward or facing your aspirations.
Okay, so we have one sister or one brother who is watching this video, and that person is a sickle cell patient. And maybe she want to know, or he want to know, the treatment procedures that you went through, which has helped you for you to live this longer, because they have some mentality out there. Say a lot of people, maybe when you reach 90 years, all those you are going to die, all those stuff. So how are you able to, what are the treatment that you underwent or undergo now? You are still here with us looking this beautiful.
Okay, thank you for the question. What I'll tell my fellow people living with sickle cell out there is that they should hydrate themselves every day, at least 8 sachets of water every day. When the pains come, they should try to cover themselves. Like, we can dress as ordinary human beings, but when the weather is cold, please don't show your body parts. You have to dress to cover yourself well.
Taking more water.
Exactly, so that you always be hydrated.
Because you need to dress like
you have to cover yourselves, pillow vests, pajamas, socks, most especially the towels that it has come on our current generation. Until better bit much socks in union route with you now. Oh, sure. It's me the papa.
To me, it's a more the any specific. It's me buying at any time.
Yeah, sure. And our diet too matters. We shouldn't eat so oily food, much spices, and yeah, because me, I've come to know myself that anytime I take granite soup, I get crisis. Yeah, so I've stopped.
And you wouldn't be in
yeah.
And
Yeah, I don't know even how to eat a mutu, so
okay.
And you should know yourself better. You should learn how your body works. Sometimes stress too. Ladies at our age, you be struggling with relationship, boyfriends, then you be stressing your body anyhow. Please, we should not put much stress on your body, because so far as you stress yourself, you're going to get crisis. And when you go to hospital, you know cannulization is not easy. Cannula therapy, hydration, pain meds, and the uncomfortability in the hospital, being on admission is a whole lot. So please, my people out there living with sickle cell, you have to take your folic acid daily, hydrate yourself, cover yourself, eat what your body wants, most especially fruit and vegetables. Yeah, and also I think there is a medication out there, hydroxyurea, that has come for sickle cell, but I don't know why in this our country is expensive, because I think outside they give it for free. Yeah, I think it's 500 cedis a month, and yeah, it corrects the abnormal shape of the red blood cell. Yeah, so it's very good. It has many side effects though, but the drug is very good. So if you are able to manage, able to buy it, you can just take it if.
So not long ago we saw your flyers everywhere that some were saying let's save Tina, what and what, and when we came here to we've seen this thing here. We've seen this thing here, and I've been seeing you most of the times working with this and all those things. But what is the cause of this?
Okay, so
is it the same sickle cell which also related to this one?
Yeah, exactly. So I must say there are many complications related to sickle cell and its types. That's what I said, it's a topic for another day. But I'm specifically type SC. Yeah, and this type SC, you will not know visually that I'm a sickle cell because I'm not anemic. And anemia is not part.
Here, no, I want people to understand, because here is very important. Because people might see you say, oh, be our sickle cell now, and on the body, and I say. So this particular place, I want it to be tree.
Okay.
So go all tree here for me.
Okay. So me type of sickle cell me wono me nye chengelenge and me sonti, because say enwi me moja. Your type of amututo ni bia every moja. Nti no anytime a ube nya ya wo wa person no. Ukọ hospital we so mubo moja, but with my type na de me kwa ensuo e na omubo me. Because say anemia nka ho, anemia so de nse yenim anemia dada. Most people out there yenim say moja re nti ebasa nipa no onya ne ho. De bia na waye moma waye nkesengeti and no na sa type no na ye nana mo pen so no na omuwu ntem no, because no one discover say bibia re bi ti say e was say omo hwe ma adu. So with my type ne de, if I don't tell you say me wa hututu ana I'm a sickle cell victim, you will never know.
Okay guys, so now no, we've known about sickle cell, nyama bebre. Yes. Before you move to the surgical parts and whatever that has happened in your life, please, you guys watch out for episode 2. We don't want the video to be long. So watch out for episode 2 so that you can know about all the surgical procedures. Thank you guys.
So he came and asked my sisters and brothers that what work do they do. So my sister said teaching, my brother was a banker, a whole lot, and he said the surgery is expensive. So he mentioned the price.